One silver lining I think that has come out of this, and there are some silver linings that have come out of this, is that the hospital systems in the region have all put our competitive hats aside and decided that the only way that we're going to be able to make it through this and keep our doors open and keep caring for our community is if we all collaborate. And there's a call that takes place 3 times a week with all of the CEOs from all of the hospitals in the region. And we talk about resources, we talk about staffing, we talk about ways that we can help each other. And that has really, kind of made us a united front in our response, the healthcare response to this virus. Back in early March, all the hospitals did what they call surge prep, and the hospitals do have to file emergency preparedness plans for pandemics, other natural disasters with the Joint Commission and also the Department of Emergency Management, which is for the state, which is Jared Moskowitz's under his oversight. And so this is something that I wouldn't say we were caught off guard, but it was really definitely in regards to a pandemic, the first time that we've had to implement surge plans in quite some time. And in dealing with a virus that was novel, a new virus that was unfamiliar to our medical community, which means not only were we doing what we could to care for the community in a supportive measure when they did become sick, but also we had to learn what this virus was, how it acted, how it behaved at this exact same time. So our clinical professionals were put into overdrive, and that goes across the region. And we expected that we were going to have this enormous surge back in March, April, May. And we really didn't. We didn't see that. We had the field hospital set up. We were ready for this to come. And it really didn't happen. It was almost kind of like we dipped our toe in the water. And then unfortunately, towards the end of, in June and July, we started seeing our numbers uptick again. And fortunately, the hospital systems were still prepared to deal with this issue in the community. I would say that all of our hospitals have done a tremendous job in fighting this virus from inside the confines of our hospital and taking care of patients. But really where we need the community's help is out there social distancing and wearing masks. That is the biggest thing that is going to help to level these numbers out. There's been a couple different things that we've experienced, one of which is staffing. Bed issue isn't really, there's bed capacity. There's what we have licensed. Each hospital has a license through the state to operate a certain number of hospital beds, and that's what we, under certificate of need, have in place. Staffing, that is another issue. I don't know of any hospital system that has 500 to 1,000 nurses sitting on the sidelines waiting for a pandemic to occur. So once this surge did happen recently, what all of our hospitals realized was that our staff was tiring out very quickly. There's a difference also between being a floor nurse and a critical care nurse. And we identified the need throughout all the hospitals, Baptist, Memorial, Broward Health, Cleveland Clinic, that we needed to have the critical care nurses. So we have been bringing in from out-of-state traveler nurses. We've also been working with the state of Florida and Jared Moskowitz's office to bring in support through the state as well. I know Baptist, throughout all of our hospitals, we've brought on approximately 500 nurses to assist our existing staff, clinical staff, during this time.